Has Sweden done perfect when it comes to the pandemic crisis? Of course not. But which country has? And has any other country done better than Sweden? Well, it depends how you define better. Let's dig a little deeper. We know that lockdown and general mandatory masking has been the mainstream way in order to decrease the spread of COVID virus. And if COVID is the only thing that we should take into considerations when it comes to destroying lives, then we have chosen the right method. But the question that we need to ask ourselves is, how do you define what is the better way to save lives and the livelihood of the entire society? And is COVID the only thing that we need to take into consideration when we're trying to reach this goal? The topics that I'll discuss today will be on why we should not be comparing countries only based on counting number of COVID cases, looking at the bigger picture of the lockdown in terms of saving lives, some thoughts about vaccinations and masking. We as humans are extremely driven by our bias and our emotions, regardless of our education, background, logical thinking, and so on. So our experiences are going to dictate how we see things in what way and how our perspectives are formed. So let's say we interviewed a group of people and asked their perspective about what they feel about lockdowns. If we interviewed doctors and nurses that have been working in ICU directly with COVID patients for months and months and seen all the suffering and death, the most likely answer that we may get from that group would be that we should do the best we can in any way possible to stay away from this virus and protect ourselves. And it's very probable that they will support masking and lockdowns and so on. Now let's say we interviewed another group of doctors or psychologists who have been working with cases of mental issues that has increased because of the aftermath of the lockdown and all the horrifying stories that they have heard and they have to be dealing with it on a daily basis. They might have a different perspective and outlook about what they think about lockdown. What about if we interview the professionals who are working with drug and alcohol abuse patients and the number of the cases that has ended up in death because of those cases? What would be their perspective? And now let's say we ask another group, children, who has suffered somehow directly or indirectly from the lockdown. And even worse, for those children who are living in an abusive home. And what if they reported that since the lockdown, since the parents have to stay home, the amount of abuse, psychological, physical, or mental, has been so much that they are actually thinking of taking their lives away? What do you think their perspective would be about the lockdown? So this is an example of how our opinion can be biased and our perspective can be based on emotions. And if we're going to make policies that are supposed to benefit the entire society, then we should take all factors into consideration. I am a Canadian citizen, but I also have strong ties to Sweden and I also have Swedish residency. And I've lived in Canada during the first year of the pandemic, and I also have lived for some months in Sweden during the pandemic. So I've seen both sides of the coin in terms of lockdown and not lockdown. In Canada alone, there are already a lot of reports of babies getting beaten up in their skull by their parents because they're going crazy because of the lockdown. A lot of number of cases of overdose and death because of drug and alcohol abuse. These are just a few cases. Unfortunately, COVID is not the only thing that takes away lives. Every day that we live, we are risking certain things on our daily basis. For instance, every time that we drive a car, we risk getting killed or get permanently damaged. Should we stop driving? Well, maybe we should, because there's going to be a lot of environmental benefit and it's also going to reduce the risk of us getting killed. But we don't. And the list of the risks we take every day on our daily lives are many. So how is it now that suddenly one factor, COVID, is overriding all the other factors of death and morbidity? And why are we not taking everything into consideration when we're making our decisions of what is a better way to do this? Although I'll be sharing a lot of supporting documents in the description, not every single point raised here is going to be backed up by a scientific paper, at least at this point, because firstly, we are in ongoing situations and some of these points need further and long-term studies. The other thing is, once we get too focused on numbers and data, we might lose the bigger picture and the outlook. So the purpose of this video is to step back and ask ourselves, are we on the right track, or are there more sustainable long-term solutions available if we're going to live with this virus for a long time to come? Counting number of COVID cases is the same argument over and over again when we are comparing countries together. For instance, when we're saying that Denmark and Norway have done better than Sweden when it comes to the COVID crisis. The issue with only counting numbers like that is that we may get ourselves in a tricky or possibly an inaccurate situation. Because first of all, when we're counting numbers only, we're not taking any other factors that are important into considerations, and we're overlooking all the other factors. The other thing is that when we're comparing countries together, even if they have a lot of similarities on paper, there could still be different factors and variables that takes an effect, and it gives us a different end result. So what I'm trying to say, for instance, if we're looking at a clinical research or quantitative research, in order to get a more relevant comparison, we need to look at all the confounding variables. So when we're comparing countries together like this, we may miss some of these variables and get a different result. So perhaps the more interesting way to look at this is to compare each country to itself over a certain period of time, and perhaps look at the excess mortality rate and then decide whether or not lockdown has been beneficial for that country or not. On this website, we're able to look at the excess mortality. We are looking at cumulative death from all causes compared to projection based on previous years. So this could be a more interesting way of looking at it, because now we're looking at how each country is doing in comparison to its own average rate of death in terms of percentage, rather than only looking at the cumulative cases of death with COVID. I would like to go back to this graph and show you a bit more details, show you how you can add countries and have some more discussion about it. But in order to move on with the next point, I will share this with you at the end of the video if you're interested to take a look. Of course, in order to get a better understanding of this whole big picture, we need to actually plug in the data and look at the numbers and do more data analysis. But this is just another way for us to look at it, to see, you know what, if we look at this in another way, we might start to see a different picture. Just to clarify, Sweden did not do this perfect, and they could have acted initially to save the lives of a lot of the elderly in the senior homes. But again, no one has done this perfect, and everybody's trying to do their best to save lives. Nobody wants anybody to die or suffer. But again, we're going back to the same question. At this point, at least, what is a sustainable way to do this if we're going to live with this virus for many more years to come? Also, this argument does not apply to the other countries with less resources, less money, less doctors and hospitals, higher density populations. Those countries have a very different situation, and their numbers are a lot more tragic. This argument goes more for countries that have more resources and whether or not they could find an alternative way to deal with the COVID crisis. Also, if we're saying that lockdown saves lives, correct? Then we really need to look at all the factors. And when we only count the number of COVID cases, we're not looking at the other factors. How can we possibly ignore the other damages that has been caused to the society because of the lockdown? How is that those numbers are not important and can be overlooked when we are looking at the overall damage that has been done to the society because of these lockdowns, for instance? Then we are going to see different pictures when we are looking at the long-term physical, psychological, emotional damages that is caused by the lockdown, all the ripple effects that are going to be seen, alcohol and drug abuse and overdose, physical and mental abuse to children, spousal abuse, all kinds of other issues that are staggering and is going to show more and more over the years. These are the numbers that also need to be considered when one is saying that lockdown is the best way, and the countries who have done lockdown have done the best, and these numbers are better than the others. So again, we need to really look at all the factors before claiming that this country have done better than the other country. As predicted, this virus is going to stay with us for a long time to come because of all the new variants, and now we're dealing with the Delta variant. Already some scientists believe that in some regions we have entered the endemic phase. So again, going back to the same point, for those countries such as Australia or New Zealand that are strictly going on strict lockdowns and really try to stay away from this virus, if this virus was going to be one single strain and we could have contained it and it would have been finished with it, then of course what we've done in many countries, locking down the people and really doing our part to get rid of it, would have been an absolutely amazing idea. And for a lot of countries, maybe that was initially the thought that this may happen. But at this point, when we know that this is not the case and this virus is going to stay, then what is the logical explanation of hiding away in fear and suppressing and locking down the society? So let's take a look at Denmark for a minute. They've done all the lockdowns and restrictions initially, and they've done a great job vaccinating the population. But at this point, now they are the first country in the EU that had gone rid of all the restrictions as of now, and everything is more or less back to normal. Again, at this point, things can change and they may go back with some restrictions. But it seems though that they are really understanding that there's only one way to go, and that is to accept that this virus is going to be with us and we need to live with it. Masking and the logic of wearing masks. There's no argue that wearing a mask helps reduce the spread of this virus and any other respiratory virus, especially if you wear it correctly. But the important thing to ask ourselves is that, again, because we know we're going to live with this virus for many more years to come, for how many more years are we willing to mask ourselves, our society, especially our young children? And how important is it for us to continue wearing masks, especially if there could be alternative ways such as vaccinations to protect the public? When it comes to masking children, there are still some experts and data that are supporting the fact that it's important to do the masking for children at school and so on. And they think that it does not interfere with any facial recognition or any other issues for children. At the same time, there are also a lot of doctors and experts, including the Swedish experts, who do believe that masking children like this does not have an overall benefit, especially since children are in the low-risk groups and transmitting the disease in schools are very low. And the argument is that is going to be more disadvantages in masking children for hours a day than a real big benefit. And some of these claims may not be easily proved with the scientific data at this point, as we need more long-term studies. At the same time, one can argue that for the elderly who still, let's say, not protected, for people with medical conditions, in certain areas where masking makes sense, very high density populations, in those cases, masking can be highly recommended. But highly recommended and general mandatory masking is a quite different thing. And what ends up happening, these children have to wear this mask for hours a day, even when they play outside, with no real big benefit. So at this point, one might ask, is this now more about logical scientific thinking, or is it now more about politics? Now, talking about vaccination, I know there's a huge separation between people whether or not vaccination is the right thing to do, the vaccine passport, all the conspiracy theory, the issue with freedom, and all so on and so forth. The thing is that if we look at this in a simple way, as far as we know, this is the best protection we have against this virus in order to prevent death and hospitalization, especially with a new Delta variant. We have now a lot of other younger, healthier group of people that are getting severely ill and getting hospitalized and unfortunately are passing away. And recent reports in countries that have a lot of vaccinations, like in Canada and Sweden, are reporting that majority of their ICU patients at this point are the non-vaccinated group. Does that mean that every single person who's going to get vaccinated is going to be fully protected? Probably not. But the chance of hospitalization and death are a lot higher in the non-vaccinated group. For the countries who have the options of getting vaccinated, a lot of the doctors and nurses that work in ICU patients with COVID cases are begging the rest of us who haven't got vaccinated yet to consider getting vaccinated, because they're in the first-hand situations where they see the suffering and death of those patients who are not vaccinated, and this could have been preventable. The other thing is that these preventable hospitalizations are continuing to strain our healthcare system, and we still need our resources and our doctors and nurses for the other medical conditions beside COVID. In terms of the right of freedom, I know it's a big issue and a big topic, and a lot of people are going against vaccination and they're really upset with this whole vaccination passport and so on because of the freedom and the choice that is being taken away from them. I believe that's a valid point, and I understand the frustration when a lot of people have fought for their freedom. At the same time, again, this is a time to unite, and even though it's important to think about our individualistic rights, it is important to think about our freedom. This is an issue that takes a lot of unity and a lot of connection between people. And if vaccination could be the way to save lives, should we not consider to perhaps think about this as an alternative solution? I know I talked about a lot of controversial issues here, and I know this is a very, very complex topic. I know also that a lot of you who are watching this will disagree with some or a lot of points that I've mentioned here. But I want you to know that I am one person with no political interest, and my interest is to stand up for the best of the entire population. I want to advocate for families and peoples who don't have a voice, who are truly suffering from this and don't really have any other ways or resources or ways of escape. and the ripple effect of this lockdown is going to stay for many, many more years to come. Sadly, this virus is causing a lot of division and conflict between people on top of all the other suffering that people are going through. It's becoming political. It's becoming about being on the left or the right, whether you believe in vaccination or not, whether you believe in masking or not, conspiracy theory, and so on and so forth. But again, this is not so black and white, and this is not the time to divide and to blame. It's time to unite and really think together as a whole, what is the best, most sustainable way to deal with this that will benefit everyone's lives and livelihood, so we can put this behind us sooner than later. Now, before I end this long video, and thanks for staying with me this far, I want to leave you with one last thought. Think about how much death and suffering has been caused by this one virus. But what about the other issues that we have on our hands for whoever that lives on this planet? What about plastic pollution that is suffocating and poisoning our earth and those that live within it? What about climate change and all the horrifying natural disasters that have been increased and will be bound to increase more over time because of our ways of living? Think about how much lives will be taken by the increased number of flooding, hurricanes, storms, tsunami, and so on. And when are we going to collectively care and do something about this before it's too late? So now we're going to look at this website, Our World in Data. It has a lot of different graphs and numbers. It's a really interesting website to take a look at. You can look up their sources of where they're getting their data. But anyways, you can scroll down and we can look at the cumulative number of confirmed deaths from the beginning of the pandemic. This is adding all the numbers together. So you can go here and you can take a look at any country that you like to see. You can unselect everything and type in what you want to see here. So for instance, we're going to add Finland, we close it. So if you see here, number of US cases are extremely higher because of course US has a higher population. So if we're only going to look at death with COVID, then we should perhaps look at the cumulative confirmed COVID deaths per million. So let's take a look at this graph for a minute. We can see that based on the countries that I've selected here, Sweden is somewhere in the middle and the other Nordic countries are doing much better. Now let's look at the other graph, the excess mortality rate, and see if you can see it in another way. So now let's look at this graph again. We are looking at excess mortality, cumulative death from all causes and not just COVID deaths. So again, we are looking at how each country is doing in comparison to its own average rate of death in terms of percentage. Now, if you look at our baseline and if you look at Sweden at its worst peak was in May 2020 and it was 10% above normal. However, if you can see here, these numbers are going down and is trending towards going back to zero or so, despite all the new waves, despite the Delta variant. And this is a country with no lockdown and no masking. However, they are doing a lot of vaccination, but there was no vaccination initially. Now, in terms of the other countries, let's say we want to compare Denmark and Norway together. These are the countries that are most similar to Sweden, as we have been comparing them over this period of time. And yes, they have done better in terms of death, for sure. But perhaps the numbers might be catching up, and we may need to look at these countries in a year or so from now to see, once we compare them together, maybe in a period of since January 2020 till, let's say, 2022 or 3. So for instance, we might see a below average excess mortality rate for Sweden for next year or so, and we may see an increase for Norway and Denmark. And overall, if we compare these countries together in a period of 2 or 3 years, their numbers might not look that different. But then again, that's just a guess or a thought, and we really need to look back at these graphs again in a year or so from now. So now looking at the other countries on this graph that had a higher number of deaths in general and also a number of COVID cases and deaths. So we can see that their peak of excess mortality rate went about 20 to 25% at the highest peak compared to average, but also we can see that these numbers are going down again. These are the countries that do lockdown and general mandatory masking, but again, as we know, there's a lot of other factors involved when you are getting COVID deaths that are not necessarily related to lockdown, and we can see it here as well. Okay, so now if you're looking at the other countries with the strictest lockdown, New Zealand and Australia, as we can see here, their excess mortality rate seems to be about average or below average. But it is going to be more interesting to see these countries again in a year or so from now to see what happens as the new variants of the virus comes, what happens if they're starting to open up, what happens with other issues. Is this graph going to look different? So going back to the same point, we need to look at all factors. We need to compare each country to itself over a longer period of time, perhaps. And then we can decide whether or not lockdown was a golden savior or there are a lot of other factors that need to be considered. Also, we need to keep in mind that when we are looking at a graph like this, other cases and numbers of long-term and permanent damages and suffering is not taken into consideration. Thanks again for staying with me this far. I really appreciate your time. And if you like this video and you haven't already, I would love to have you stay connected by subscribing to this channel. Thank you.